Thanks for joining us for today's webinar on expanding inclusion of fathers in perinatal and early childhood programs. This webinar is co-sponsored by the Institute for Research on Poverty and the Wisconsin Child Abuse and Neglect Prevention Board. I'm Dave Chancellor, I'll be your host, and I'm so happy to introduce our presenters for our webinar. Dr. Tova Walsh is an assistant professor in the School of Social Work here at the University of Wisconsin-Madison and a research affiliate of the Institute for Research on Poverty. Darryl Davidson is executive director of the Milwaukee Fatherhood Initiative. Dr. Kevin Gruenberg is co-founder and director of Love Dad Support for Fathers and Families. And Calvin Williams is founder and president of Lucian Families. So I want to thank all of you for being here. Thanks so much.
Absolutely. Thank you.
Thank you.
Yeah. I also want to acknowledge the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for their support of IRP as the National Research Center on Poverty and Economic Mobility. That said, any positions expressed in today's webinar don't necessarily reflect positions of ASPE, the Institute for Research on Poverty, or the Wisconsin Child Abuse and Neglect Prevention Board. So as we get started, I just want to give you a quick outline of our webinar today. We have an hour, and Dr. Tova Walsh is going to lead us sort of in a broad introduction of the topic as we get started here. And then we're going to turn to Darryl Davidson, Kevin Gruenberg, and Calvin Williams before we move to kind of a broader discussion with a lot of the questions that you all asked when you registered for today's webinar. And if we have time after that, well, we should have a little bit. We're going to turn to your questions in that informal Q&A. And so you'll see that there's a Q&A box on the bottom of your screen. You can type in questions all throughout today's webinar. Some of those we might answer just in chat, and others we're going to answer live towards the end. So we appreciate all your questions. You will see that we also have chat enabled, and so you can participate as much as you want on there. We love hearing where people are coming from, the sort of work that you're doing, and so please feel free to jump in there. We are recording today's webinar, and so if you have to leave early or you want to share this afterwards, I should be sending out a copy of the recording and Dr. Walsh's slides later on tomorrow, so you can look for those in your email. We're also going to have those posted on the IRP YouTube channel, and the Prevention Board will have them up in their resource library later on. With that, I want to turn it over to Tova. Thanks so much for being here, Tova.
Thank you, Dave, and thanks. I'm really excited to have Darryl, Kevin, and Calvin here to speak with us today. I'm going to put up some slides to share with you. So hang on just a second here while I get that going for us, and I'm going to share my screen with you. Sorry, hold on just a second. Not working for me right now, and we just practiced, but here I go, having trouble with the slides. Sorry, everyone. I'm going to try one more time, and then I'm just going to go for it without them, and we'll send them out to you afterward. I'm not sure why I'm having trouble. Are you seeing it now?
Yes.
There we go. That looks perfect.
It's perfect. Okay. Excellent. Okay. Sorry about that glitch for a minute there, everyone. So we're really happy to have you with us to be talking about expanding inclusion of fathers in perinatal and early childhood programs, and really looking forward to getting into discussion with our presenters. So I'm going to do a quick overview, like Dave said, just a kind of framing with what the research tells us about this topic, and then really looking forward to hearing from three experts who are working in this space about the work that they do. And so just to give you a sense of where we're going, after I speak, we're going to hear from Calvin about the work that he does supporting professionals and organizations that support breastfeeding to strengthen inclusion of fathers. We'll hear from Kevin about his work increasing support for fathers and home visiting services. And we'll hear from Darryl about the work that the Milwaukee Fatherhood Initiative does to provide comprehensive support for new fathers. And then we'll move into questions and discussion. And, before I move into talking too much specifically about the topic in relation to engaging fathers specifically in perinatal and early childhood programs, I just want to, call attention to the fact that we've done a series of webinars here. And for those who are interested in a broader framing around what are the unique contributions of fathers to their children's development, or ways of engaging fathers in programs specifically for fathers, or including fathers in broader family programs, I encourage you to check out some of those earlier webinars, which might answer some questions that you have, or be useful to you in your work. Where we're starting from today is recognizing that positive father involvement is associated with a range of benefits for children across their lifespan. So the positive impacts of having an engaged father start even before a child is born. So start during pregnancy, and we'll talk a little bit about that as we think about perinatal programs, and extend across childhood, across adolescence, and into adulthood, and even intergenerationally. So we know that boys who experience caring relationships with their fathers during childhood are more likely to be positively involved with their own children as adults, as one example of an intergenerational benefit to children of having that positive father involvement. And as we think specifically about father involvement early on, one thing that's really exciting about the opportunity to engage fathers in perinatal services and in early childhood programs is that early father involvement is significantly related to later paternal involvement. And so any efforts that we make, those of you on the call who are providers and who work with fathers and families, those early efforts are really significant in terms of setting up trajectories of positive involvement across the childhood and even into adulthood, supporting fathers to get involved and stay involved in the ways that they would like to be. So I want to talk a little bit about the involvement of fathers before and after birth and what it means for their families. So we know that father support is associated with a host of positive outcomes for moms and babies, or moms and children as babies grow into children. And I offer just a few examples of those here, that when mothers have the support of a partner, that's associated with earlier entry into prenatal care, with fewer health problems in pregnancy. We know that fathers can play a really critical role in helping to identify changes in their partner's mental health. So if a mom is struggling with depression surrounding the birth of a baby, that a partner can play a really important role in helping to recognize and support a mom, both directly providing support, but also with getting connected to other support that she might need. We know that closer relationships between moms and dads, whether they are romantic partners or whether they're co-parenting, are associated with lower levels of stress for moms. And so that's a really critical role that fathers play. And we also know that the quality of the relationship between parents predicts how each of them will nurture and respond to the needs of their child. So another way of saying that, when moms and dads support one another, they're in a better position to provide the support that they would like to be able to provide to their baby. They have support and they're able to, to give support in turn. So some of the research that I've done with colleagues looks at the involvement of fathers in prenatal care and prenatal services. And one point that I want to make that I think is just so important is that both mothers and fathers want and expect fathers to be involved. So sometimes when I talk about involving fathers in prenatal care, people think, okay, well, dads want to be involved, but what would that mean for moms? Well, in the research that we've done with moms and dads, moms tell us that actually one of the things that makes them most dissatisfied with the care that they're receiving is when providers aren't receptive and aren't including fathers in those appointments. That it means a lot to moms to have a partner with them, to have a dad there to ask questions, to help them with remembering and bringing home and applying, the information that they hear from the providers. That they want dads to have a space to ask about their own concerns and get support that they need. And that when they find the providers unwelcoming towards fathers, that is something that makes them really dissatisfied with the care that they receive. I also just want to underscore that role of dads as advocates. One of the things that I hear in work with pregnant moms and moms who are parents of new babies is just how important it is to have the father welcomed into the perinatal care spaces to be an advocate when they have concerns about their care, to have another person backing them up, to support them and amplifying the questions that they have and making sure they get the answers that they need and deserve about their care and about what the baby might need. We also know that participation is highly meaningful to fathers, that being able to be present in prenatal care and postnatal care and pediatric visits and home visiting and other early childhood services means a lot to dads, and that dads want to be recognized in those spaces for having a dual role as a parent and a partner. So if it's a prenatal service, part of their role in that space is being there to support their partner who is pregnant and expecting a baby, but they're also there as a parent in their own right and want to be recognized as a parent and have the opportunity to ask their own questions and get answers and get the support that they might need around parenting. And so I think coming out of this, the big takeaway is that providers, can and should be really intentional about including fathers. It means a lot to both fathers and mothers when they do that. Another thing that I want to highlight is that sometimes dads might feel marginalized or uncertain of how to engage. Maybe they're encouraged to come to an appointment, but not kind of really told what their role is when they get there, or depending on the nature of the setting, maybe they show up and they're guided to sit in a corner of a room and it's kind of unclear kind of what they are meant to be doing and whether they are kind of meant to stay quiet in that corner. We can be really intentional about making people feel welcome, inviting their questions, supporting their participation in a variety of ways. And another thing that I hear in my research with dads is that dads have specific questions and knowledge needs about how they're going to engage with an infant or a toddler or a very young child. So having the space to ask those questions, whether it's in a home visiting program, an early childhood program, a perinatal program, is really important. Dads bring these questions and we can support them in providing answers as providers. So I want to say just a little bit about fathers and home visiting from a research perspective, and then I'm really excited to hear about the work that Kevin is doing in this space with providers more directly. And I want to highlight an intervention called the Dads Matter Home Visiting Intervention, developed by colleagues of mine in social work, Jennifer Bellamy and Neil Guterman. And the next slide will have a link to where you can learn more about this intervention. But they developed an approach that is intended to provide training on how to better engage fathers and increase fathers' participation in services. And we know that historically, fathers haven't generally been very well engaged in home visiting services, but that when fathers are engaged, that is positive in multiple ways, that it's associated with families staying in services longer. It might be associated with fathers' continued involvement with children over time. And so I think it's really powerful to know that there's an intervention that's been developed and really studied about how to optimize support for fathers' participation in home visiting and for fathers' involvement with their children and families. And so this slide, which will get shared with you, has a link to where you can learn more about the intervention. It names some of the domains of that intervention. And I wanted to highlight this because some of the questions that came in through the registration for this webinar touched on some of these topics. How do I work with mothers and fathers who don't communicate well or who maybe have areas of conflict? So this is an intervention that addresses and offers strategies specific to those concerns, to thinking about addressing conflict or challenges between parents, to improving communication. And so there's a focus both on the relationship between parents, but also working with fathers to support them around fathering specifically, around their own needs that they might have and getting connected to resources. So I wanted to highlight this and offer it as one potential resource for programs. Want to name a few strategies for expanding inclusion of fathers, and then this is the last slide I'm going to share, and I'm going to turn it over to my colleagues. A few things that I want to highlight as opportunities for expanding inclusion and for creating a father-friendly environment in perinatal and early childhood programs. So one is really recognizing the perinatal period as a moment of opportunity, that oftentimes if you are working in a space that is focused on pregnancy, is focused on early childhood, early parenting, fathers are showing up. And so this is a moment where we can be connecting, we can be inviting and welcoming and supporting their participation and thinking about how to make it really clear that this space is for them as much as it is for mothers and children. We can be intentional about communicating with fathers, including non-resident fathers. So if you're sending out communication and a child has more than one household where they spend time, making sure that communication is going to all of the households. We're going to hear from, and I'm excited to hear from Calvin about his work specifically about supporting professionals who work with folks to support breastfeeding. If we're reviewing information about breastfeeding and about eating routines and other things to do with infancy and taking care of new babies, we can be reviewing that information with all parents who are involved in caring for children and recognizing that providing that information to all parents is the best way to create a really supportive environment for that baby. Some things we can also do include addressing practical barriers to engagement. So understanding if the timing of the services is presenting a challenge around father schedules. If there are other logistical or practical barriers, kind of thinking through how we can make the services more accessible, how we respond when when people need to reschedule because life intervenes, thinking about ways of really making things accessible to fathers and responsive to their needs. Creating a father-friendly environment, and by that I'm thinking about things like making sure that you have imagery that shows fathers and their children as well as mothers and children and mothers and fathers and children, making sure that everyone in the space, not just the people providing direct services, but the person who welcomes people or schedules appointments, that they are also intentional about making a father-friendly environment. Reinforcing fathers' contributions, so recognizing and appreciating the things that fathers do and the knowledge that fathers bring as experts on their own children. Another strategy is normalizing screening for fathers, for example, around depression, and discussing father-centered health concerns. So we, as a field, Child and Family Services has really, I think, really kind of gotten even better at recognizing and normalizing the presence of depression in mothers and doing screening and getting mothers connected to support they might need. And I want to name it as an important area for continued improvement, that we be thinking about all parents and their mental health and well-being surrounding the birth of a baby, recognizing that all parents' well-being really matters for their children, and that we can get people connected to resources that can help to improve their well-being and buffer the effects on children if parents are struggling with depression. Offering resources, and Darryl will really touch on this, to achieve not only parenting goals, but related goals. So fathers might be thinking about things they want to do differently in other areas of life to facilitate the life that they want to create for their family. So learning about what fathers are looking for and helping fathers to get connected. One agency doesn't need to do it all, but knowing kind of what's out there in your community that you can refer fathers to receive support in other areas of their lives. And so that can involve collaboration. And then that can also involve not just the direct service provision, but advocating for family-friendly policies and policies that recognize the important role of fathers and center and include all parents, recognizing the contributions that all have to make. So with that said, I'm about to turn it over to my colleagues, who will each take about 10 minutes to speak with you before we move into questions and discussion. This last slide, I'm just making sure that you know it's there, and then you can look for it when the slides get sent your way. But I do want you to know that you've got contact information for all of the presenters. So I hope you're going to hear things that are really of interest and useful to you. And if you do want to follow up with any of the presenters afterwards with further questions, you can do so. The other resource that was on that slide, I included a link to a great resource for photos of diverse fathers and families. It's the Alameda County Father Corps Fatherhood Photo Bank. And I share that every time we do one of these webinars, because I think it's such a terrific resource for programs to think about how to really expand representation of fathers and families in your programs. So with that all said, I am now going to invite my colleague Calvin to jump on and speak to you about the work that he does supporting fathers and breastfeeding.
Thank you, Tova. Hello, everyone. I'm so happy to be here. There's nothing like gathering to talk about fathers and fatherhood. I've been doing this work for over 23 years as a fatherhood practitioner here in Ohio, Oklahoma, and other places around the country. I became a certified lactation consultant in 2018 after I was literally transformed by a 2017 Reaching Our Sisters Everywhere annual breastfeeding summit. That experience opened me up, helped me understand things about infant mortality and Black infant mortality, and then the mortality and morbidity issue with pregnant and delivering moms in our society. And certainly those are more entrenched issues for Black mothers. So I fused my passion for fatherhood with my newfound passion for breastfeeding, supporting and promoting breastfeeding. So since then, I've created over 18 trainings and workshops around fathers and breastfeeding, and on the inclusion of fathers in maternal child health work across the board as I've grown in my knowledge and understanding in this area. So those 18 trainings, I'm really pleased to have been able to do them, because they are to the frontline people that are serving families in maternal child health. So the pediatricians and peer counselors and WIC staff and things like that. This year, I did trainings for the Ohio WIC Association, the Association of Women's Health Obstetric and Neonatal Nurses, and the Reaching Our Sisters Everywhere annual summit that was held in New Orleans this past August. So maternal child health providers could serve moms and babies better by being more educated about fathers. And when I say educated about fathers, there's a context or paradigm, I should say, that I operate from, and it's the 3 dimensions of a father, right? And I use this because we're so used to thinking about fathers in a one-dimensional framework. And so I look at a father as the man himself, the human being, the person, their conception, their ideas about the role, and then their parenting behavior. So it's 3 separate things there in that construct. And the reason I do that is to tease out the fact that fathers are not monochromatic. They are not just obelisk, right? They are flexible, feeling, thinking, yearning human beings that have more dimensions than just doing what they're supposed to do to raise their kids. So that's why I do that. Evidence that a father's own life course can be significantly and positively affected by the paternal role is robust, and including my experience as a father of a 29-year-old son. Fatherhood has and continues to affect my entire life course. So this is not small potatoes we're dealing with when we have an opportunity to engage a father in pregnancy services, labor delivery, and postnatal services. But in order for the father to realize those benefits that are available to him across his life course, he needs to be supported in several ways. And then moms could do well to be educated on fatherhood development, the ways, there's no one path for men to become fathers, but the ways that fathers develop boys and adolescents and develop into fathers. And then they need to be educated on the diversity of fathering styles. I do think that in reproductive health services, that there should be some information to young girls about fatherhood and about what that is, what that means in a broad sense, and lining up with the research as well, which all adds up to they're really, really important and not to be dismissed too easily. So the other thing I think about and have been working in a lot in the past few months is fathers and perinatal mental health. So to that end, I joined the International Marseille Society for Perinatal Mental Health because they have a father special interest group. And I get a lot of good information from them about fathers' mental health in the perinatal period. So some of that information is that anxiety and depression are most common in the perinatal period. Anxiety in the prenatal stage can range from 4.1 to 16% of men experiencing anxiety in the prenatal stage. In the postnatal stage, that is 2.4 to 18% of men that can experience anxiety in the postnatal stage. Depression has been tracked at 10.4% from the first trimester through 1 year postpartum. And that's really important. So we don't want to let go of fathers too soon when we're providing them these important services. So some of the factors that play out in terms of this anxiety and depression, things that are playing out in fathers, is the formation of their fatherhood identity. Men just don't land with a thud at a fatherhood identity, right? So that formation needs some attention. The competing challenges to the fatherhood role in men's lives, and then the negative feelings and fears related to being a father or becoming a father. So we absolutely have to continue to advance in our understanding of men and fathers in the maternal child health space. And I'll give you a quick story to wrap up of my son's birth. No one was talking to me at that time about pregnancy, fatherhood, breastfeeding, and mental health. Not a peep, not a sound from anyone. At about 8 months of age, my son's mother and I broke up, right? I had an acute negative mental health incident where I considered whether my life was worth living. What kept me, along with some good friends, but what really kept me and gave me that push forward was the spirit of, the voice of, and the presence of my father inside of me. And that's what I used to set out to be the best father I could be. Thank you so much.
Thank you so much, Calvin. We're going to turn now to Kevin, who's going to talk to us about his work around supporting fathers within home visiting programs.
Thanks, Tova, and Calvin, thanks. I was really excited to hear you speak and to hear you end with what you said. It's often hard for men to talk about things like that. So I take that really kind of seriously, and I'm grateful. Well, I like to start kind of with a very obvious point that actually Tova and Calvin didn't say, so I'm glad I can be the one that says this. And it's a bit of a reminder that I hope we all can take seriously. And I think if we can really sort of digest this, meditate on this, and let this sink in, you might get all you need from at least my portion of the talk. And that's that about 50% of parents identify as fathers. I'm going to say that again because I'm sure there are some eye rolls or at least something like, why is he saying this? We all know that. About 50% of parents identify as fathers. And that includes even fathers who don't live in the same homes of their children. And we have this huge dilemma, actually. And as Tova talked about, and Calvin, about just how important dads are to the support of their children, the growth of their children, to support maternal well-being and family health and resilience, that we have this huge dilemma that that dads are participating in our programs, particularly in home visiting, at very, very low numbers. And we're missing opportunities actually to support whole families and to really promote family health. I'll talk a little bit about some of the things we're doing in Los Angeles to address this gap. So Love Dad partners with Los Angeles Best Babies Network, who oversees a network of 35 home visiting organizations implementing 3 different models. So Welcome Baby, Healthy Families America, Parents as Teachers. In this network, there's over 700 staff members and services over 22,000 families each year. This is actually, Los Angeles County is one of the biggest counties is the biggest county in the country. So what we do here really, I think, has an effect on what we do nationally. And our work has really been on not so much about creating programs specifically for fathers, but really expanding the scope and focus of home visiting, expanding the maternal child health and infant health focus to promote this idea of family child health. I'm going to say that again, family child health, which is something that we don't often talk about or think about in home visiting. And we can't really support family child health without including fathers as central to our support services. So our approach has actually been to take what we do in home visiting, which is very effective, it's research-based, and it's really helping parents with all the most important things that they need to know about being parents. And reframe messages to be delivered to both parents when possible, or to figure out ways to get information to parents when they're not present. So I'll give you an example, a very simple example of something that happened with a hospital nurse we trained. So in this hospital, the hospital nurse enrolls families into home visiting. So she's enrolling a family and she asks if the family has any questions, and there's a mom and dad present. And the mom begins to open up about these breastfeeding challenges she's having. And I appreciate Calvin going first, because you all know that breastfeeding is actually a family issue. Feeding your child is actually a family issue and can be supported by a whole family and both parents. And so this hospital nurse knew that and started discussing breastfeeding, but to both parents at the same time, and including both of them in the conversation. And as she was talking about breastfeeding, she started talking about skin to skin and asked the parents, like, if they had any other questions. And the father kind of says, in an emboldened way, can I do skin to skin? Is this something fathers can do? And she encourages him on the spot to do skin to skin. And he's so deeply moved by this, this experience. And what he learns and what he knows is that home visiting is actually for him too. And that when parents or when fathers are addressed in these sort of these critical moments of transmitting parenting information, that they know that they matter and that they can be included. And actually, he participated in home visiting throughout the whole course of the time the home visitor worked with the family. So in partnership with Los Angeles Best Babies Network, who oversees really training protocols and onboarding of all home visitors in Los Angeles County, We've mandated father engagement training for every new home visitor in this network. Basically, now at this point, every home visitor in our network has received father engagement training, and father engagement is considered on par with bonding and attachment, developmental milestones, maternal mental health, screening, etc. And I want to highlight just how it's easy for me to say all this stuff for you all to do, but I want you to take seriously about the roles you all have as home visitors. You're trusted by these families, you're in their homes, and you have curricula that is research informed and curricula that actually can benefit both parents. And I want to encourage you not to necessarily go outside of your models, but to really think about how can you use your model to share the information with both parents at the same time. And it's a great opportunity. The fact that families trust you, there's really no better person in their lives to receive this information from. But it's critical to assume that dads want to participate. It's not enough to just welcome dads into home visits, but we want to engage dads. We want to let dads know that they're valuable. And we I'll give you I'll highlight this point. Like, we'd never welcome a mom into home visiting. We'd engage a mom. If a mom wasn't present, we'd want to know why. We'd call the mom, we'd text the mom, we'd email. We'd want to make sure, what are the barriers that are getting in the way of a mom being present? We want to have that same approach with dads too in home visiting. And this starts from the beginning, as this hospital nurse did, where she presented this information to both parents. We want to make sure dads are included in emails and in scheduling. We want to make sure that if the dad is not present, and we know there are a lot of barriers to why dads aren't present, that they get the information they need, if it's in the form of a handout, if it's encouraging them to call in or Zoom in. We've had dads call in from backhoes to home visiting calls in Los Angeles County to make sure that they could ask questions and that they could learn about the things that the home visitor had to share with the family. One of the things that we also, that Tova talked about, is that we promote teamwork between parents. And this is probably the most underappreciated and important point that home visiting tends to miss, is how important co-parenting is to child development. And so we're always encouraging parents to talk to each other, and we're encouraging home visitors to facilitate these conversations. Also, recognizing bias and stereotypes is just such an important part of home visiting. And bias and stereotype exists at the level of a practitioner up through even how curricula and programs are developed. And at the level of even systems, I should say. Fathers are so easy to write off. And that could be because of cultural understandings we have of what role dad should play in a family. It could be about traumatic experiences that home visitors have with men. It could be about racism, and that dads who don't live in the same home aren't involved with their children. And that's a big assumption we have about Black dads, and it's just erroneous and racist, and something that we need to challenge. Or if it's programs that are really just geared towards moms and babies. I'll give you another story. That there was a family who had a child in the NICU, and a home visitor had met with the mom and dad once, and knew from the get-go that the dad was deadbeat, that he was not going to be useful and probably would leave. He had a shaved head and neck tattoos, and for her, seeing a man with a shaved head and neck tattoos means that you are not a good person, really, and not a good dad. And so when the mother started sharing a story about waking up in the middle of the night and not finding dad at home and panicking, the home visitor immediately had all of her assumptions confirmed, only to come to find out that the dad actually, as the mom told the story, actually went to the hospital to see his baby and learn about diapering and swaddling from the nurses there. It was a quiet time in the hospital, and his baby was coming home in a week, and he didn't know how to diaper or swaddle in a way that he felt confident about. So he went in the middle of the night to learn about it. And the home visitor sort of mind was sort of blown a bit in terms of confronting her own bias and stereotypes. We all have them, but we all need to be open to what we can learn from families, and not foreclose on opportunities to support dads and to learn more about their experiences. Day-long trainings are not enough. We need to be supporting home visitors and supervisors in an ongoing way, and kind of reflective consultation, and creating structures really for fathers to be engaged. No one is really good at this nationally, and we're all learning. And so we need to create a supportive atmosphere in order to do this. And just to finish off, and actually Calvin was talking about the mental health of fathers, and about how 10% of new fathers are experiencing perinatal mood and anxiety disorders. Well, in Los Angeles County, we're starting a project this spring where we're starting to screen fathers in home visiting and referring them to mental health services and getting them treatment in timely ways. Like mothers, we know that when dads struggle, this really affects families, and that we can't really provide parenting information to parents without also taking seriously their mental health. Because if you're struggling with your mental health, it's really hard to implement effective parenting strategies. And so this is actually not really, I mean, other than in a few small pockets, this is not really done nationally. This is something that if we want to promote family health, we have to screen fathers for mental health, and we have to be able to get them services. Now, one of the challenges that most people find, and one of the biggest barriers, is that the mental health system, at least in Los Angeles County, is not equipped to treat new fathers for mental health challenges. So part of this project has actually been working with organizations within mental health to develop their capacity to treat new fathers struggling with mental health problems. And we're using interpersonal psychotherapy, or IPT, which is an evidence-based practice. We've developed a specific training to use this model for fathers, and have just started actually this month training therapists in Los Angeles County. I'm telling you all this because you can do this too. This is, none of this is actually groundbreaking. It's just that we're doing it, and that we're facing adversity, and we're pushing through, and we're finding people to collaborate with, and we're motivated. And there are people I know who are on this call today who are a part of this fight in Los Angeles, and supporting this work. So with that, I'll turn it over to Tova and Darryl.
Thanks so much, Kevin. So I just really appreciate what both Calvin and Kevin have shared. I'm excited to hear from Darryl, and I'll also call your attention, everyone, to the great ideas getting shared in the chat. So I invite you to share strategies that are working for you, and to take a look at what other participants are recommending as working for them, as well as, sharing questions is very welcome too. With that, I'm going to turn us to Darryl and invite Darryl to come and speak with us a bit about how the Milwaukee Fatherhood Initiative supports fathers in addressing a range of needs that they might have.
Thank you, Tova. I also appreciate what Calvin said, as well as what Kevin was expressing. I do want to elaborate on some of what they were talking about too, with information that we have from our Milwaukee Fatherhood Initiative. For those of you who are not familiar, our Fatherhood Initiative has existed for a little bit over 15 years. And the mission is to create a collaborative partnership for father-serving organizations. We're trying to promote positive involvement of both parents so that they can influence the lives of their children. We're doing this under the guise of promoting human dignity and respect and inclusion and equity. We promote advocacy and empowerment, and we also are working with related to the issues of what their level of commitment is, integrity, and trust. It's really essential that when we first start working with our fathers, and if anyone asks, how do we work with our fathers? I generally ask them, are you really ready to work with fathers? This, because the resources that we are attached to are very comprehensive. Health screenings, including mental health screenings, parenting classes, child support interest debt relief, driver's license recovery, violence prevention, continuing education, working with parent coordinators in schools. Mental health providers are also a part of our provider network. We have so much that's a part of our umbrella. We can't do this alone. That's why we work in a comprehensive capacity with varied partners. And what we're trying to do is make sure that the impact is extremely broad. At the Milwaukee Fatherhood Initiative, because we're working with so many different sectors, we had to get approval from the mayor of Milwaukee, Wisconsin, in this case, Mayor Cavalier Johnson, so that he could provide resources to come directly from the city and also work closely with Milwaukee County. Again, it's not just our organization, but there's multiple organizations that work with fathers. However, we have a hub of numerous organizations that are attached to us. And we also host a very large scale organizational commitment each year. We just had it recently, the Milwaukee Fatherhood Summit, where many of our partners are together under the same roof. We had it in a gymnasium and also in a school. And now we approach fathers and introduce them to numerous things that we have during the year, but we have a one-stop shop format. And this particular activity is extremely helpful, and fathers have been coming for years and explaining to us how necessary it is for them to not only receive the services in one day and make the connection between different service providers, but also it reactivates their commitment to family and their children. A couple of things I do want to also bring out as far as the commitment. Early on, when we have our meetings with fathers, and we work with different types of families. The fathers could be in the home, the fathers may not be in the home. These might even be referrals that come from the mothers who really want the fathers to be very engaged. And many of you may have this situation going on. But the fact is, what we let people know is we are promoting the fatherhood activities first, which means that even if we're doing family-focused activities, if we're going to have a series, we have the fatherhood-focused activity on the first day, letting the fathers know that they're not only welcome, but we try to have it so that we describe information in father-focused terms and male-centric terms. We have a lot of humor attached to it. And one of the reasons why we're doing this is because, especially if we're working with a father at a prenatal level, we want to make sure that if he doesn't have a question for us, often it's because he doesn't know what there is to ask. And so we let him know that we're available for any question at any time, and we give him information and let him know also that not only will there be other sessions, but there also are other fathers that are available. We have a network of fathers who have graduated from our classes. Our classes are generally about 13 weeks long with our curriculum, but we have fathers that have made themselves available to talk to newer fathers. And that is one way to include our prenatal as well as our new fathers who are antenatal. Other things to also address. Early on, we do talk about the expectations. So yes, it is true that many of the fathers are going to approach us. They may be nervous. They may have fears. Some of our fathers are teen fathers. If that is the case, we give a assessment. We give surveys to these fathers. We do want to explore if there are any mental health concerns, but just as important, we also want to make sure to identify if there's any issue around them communicating the problem that they may have that they're walking the door with. Sometimes the father may be nervous, not because he's having a child, but because he doesn't believe that he has anything to provide to the child. It may be related to the lack of education, or maybe related to not having a complete fulfillment in the type of employment that they're working with. So we engage the fathers in those types of discussions as early as possible. And we also want to make sure to let the fathers know that everything is not about the paycheck. There are so many different areas where the father can be engaged, and it could be something as encouraging as getting that child to smile, or with the mother, making sure that the mother is comfortable. We want that mother to be less nervous. We want the mother to rest. We want that father to talk about what their schedule is like when they are resting or when they are designing any type of practice that's going to continue with their new family. If the father has other children, we want that father to talk to the other children about the arrival of the new child. So the father actually does have a role that has less to do with money, but everything to do with managing the expectations and getting that family focused on making sure that that baby is safe. We are encouraging the father taking first aid classes as well as any type of care classes where they will learn how to support breastfeeding. They will learn how to swaddle, learn how to change diapers. If that is not the case, we are going to promote that in the classes that we are hosting at our offices. In the past, I have been a supervisor of home visiting programs, and home visiting program, our direct assistance to dad's project, which was offered through the Milwaukee Health Department, also was connected to the Parents as Teachers curriculum. So for those of you who have a particular curricula that may not seem as father focused or as father friendly, I do concur with what Kevin was saying earlier, which is there are ways of getting the program modified or adjusted so that it does have a stronger father focus. But I still maintain that if there's going to be group activities, so for example, a monthly meeting between the parents, see if we can have that meeting with the fathers first. Other elements that I also want to let people know about, we are sharing our data with all other agencies as well as the school system. The reason why we're doing that is because we're allowing people to engage with us and provide us with information on a professional level. So we do have people who are working with us as colleagues who meet with us periodically, and we can have the conversation about what are we doing, what do we need to add, or what do we need to take away from the various programs. We have a similar type of relationship with our fathers. So we are asking fathers questions regularly. We constantly are promoting getting the fathers engaged with our survey activity. Our surveys are typically paid surveys, so it may be a gift card or some other type of stipend. Fathers to take a look at the curricula so that they can identify what might be needed. But in the end, what we really want people to do is ensure that the fathers have a voice. The fathers are not a secondary parent, and the fathers often do not see themselves as a principal part of the child's life. Maybe it's because the father did not have a father or role model of a father of their own. But that doesn't matter as much if they are able to engage with a program or an advocate who at the very least is letting that father knows that he's valued and that there's not really a wrong way to approach being a father in this case. What you're looking for is the commitment, and it has to be consistent. So in the earliest stages, what we let the fathers know who are involved with us is that you can't back out of this. If you say you're going to be a committed father, you're going to be an engaged father, okay, make sure that if you keep a calendar book, that it's on the schedule. These are the things that I'm going to do. You also not only list what you're going to do for the mom, but you're going to list what you're going to do for the baby, even if the baby has not arrived. And then once the baby has arrived, you can create a calendar of other types of activities, which is not that hard. Example of that would be, most people have cell phones that have a camera feature. The fathers can put a date on the calendar. It could be the first day of the month or within the first Saturday of the month. And that is the day when they're going to take pictures every month of that child. If they take pictures every month of that child, what's going to end up happening is that's going to be a regular habit that typically they don't even have to keep putting on the calendar, because other people will say, isn't this the day that you were going to take a picture of the baby or the small child? Those types of habits are what we're looking for to create and engage fathers at a very basic level. Now, I'm going to turn it over back to Tova because we only have a few more minutes left, but I know that we have questions and I can get more detailed on some of the activities that we do here in Milwaukee with some of the questions that are being asked.
Thank you so much, Darryl, and to all of our presenters. So I'm going to invite Kevin and Calvin to turn their cameras back on. You'll be able to see all of us as we have some question and discussion time here. And I'm just going to bring out a couple of questions that have come in during the webinar, as well as some that came in advance. So one question in particular that folks had was for more guidance around engaging fathers who are potentially not part of the household and supporting moms around recognizing the importance of involving fathers even when they're not partnered. Kevin, maybe you could start. You had said a little bit about in your training some of the ways that you support when fathers aren't at appointments, like how you approach encouraging people to get information to dads and encourage their participation. And then maybe Calvin will go to you next. Okay. Thanks.
Well, it starts for me with the most basic, figuring out the most basic information. And what we discovered in actually learning more about intake paperwork is that actually in some of this intake paperwork, fathers weren't even a part of that. There was nowhere even to write father's information on the paperwork. So one thing is that we have to get the father's contact information. That's sort of a critical point. We have to be able to talk to moms about how important dads being involved are, and how important it is for the child. And also, I mean, other than if there are real safety issues, that it's important also for mom to be the best mom she can be. I mean, these are some of the really basic ways. Also, you know, contacting the father around letting him know about the services that we have. Again, like these things that we often just overlook, that we just don't do, are some of the basic things that we're often recommending, and trying and making sure that they get the information, parenting information, even if they can't participate in a meeting. So that could be like a handout around about mental health, or about bonding and attachment, or it could be about anything. I'll let Calvin and Darryl add to this. I'm sure they have other great strategies.
Thank you. And Calvin, as you speak to this one, if you're able to pull it in, there have been a couple of questions that have come in specifically about OB visits or breastfeeding related appointments or meetings with midwives. In those spaces, how you think about including fathers and working with moms also to see what the value might be of involving fathers in those appointments.
Yeah, sure. So as far as co-parenting, I did co-parenting coaching for 7 years. I contracted with a local fatherhood program in Cincinnati. And so every father, they had like 300 plus unique fathers every year. They would get a referral to me, and I would see if they needed or wanted co-parenting coaching services. So that experience leads me to say, instead of guessing, estimating that the father is not involved, you should guess and estimate that he is involved and that that relationship is very likely to need some support. Let's go with that assumption from the jump, right? Because the co-parenting relationship can and will scuttle progress, not only in areas around the mom and baby's well-being, but the father's own livelihood and other areas that are critical. So that co-parenting relationship is really important. So relationship skills and things like that should be available. For maternal child health providers, engaging dads, I have, and it's really easy and simple rule, it is speak to dad first. Not the hello. After the hellos are done, make your first question or statement to dad. And that'll set that tone for that. The last thing I'll point out is that I have created very simple, a one-pager with double-spaced research points about the value of dads to children, and I would give those to moms in my co-parenting practice.
Thank you so much. And Darryl, I'm actually going to turn to you with a different question, if it's okay, just in the interest of time and pulling in some more questions. There have been a couple of questions about what if you want to make referrals, but there aren't so many resources for dads in your community. So when you think about with the MFI and all the partnerships you have you done things to support the creation of resources, or if you've noted gaps where I don't know where I could refer a dad for this need, kind of where do you go from there?
Well, the first thing I'm going to say is please call or email our offices. I know that Tova, you sent the email. Yes, here's the issue that has been long standing. We do not have sufficient father-serving organizations across the country. And even some of the organizations that probably could serve fathers, they don't think about that. They don't really see themselves that way. And we're on a mission where we're trying to incorporate that particular strategy so that people will think of themselves as father-serving organizations, as well as if they are maternal and child. But I am encouraging people, go ahead and call us, primarily because many of us, we do have resources and have networked with people from different parts of the country. You would be surprised at the number of people across the country and various states we've worked with who will say, well, we have a one-person operation, or we have this this small agency and they're only open twice during the week. But if they're in your state, we'll tell you about them because we are creating a database around that. So yes, I'm looking forward to any questions or comments related to that.
Thank you, Darryl. So I am just appreciating all the great questions and suggestions coming in the chat. I've put in a couple of places the contact info for presenters, since it's coming up that a number of folks are interested in reaching out to you, Calvin and Kevin and Darryl. And Darryl, I'm going to just suggest you invited people to call your office. If you'd like them to be able to do that, you could put that info in the chat so that people have the number. Awesome. So I'm going to turn to another question. So many great questions here. And one set of questions that came in advance really had to do with thinking about fathers, the cultures and the different expectations around fatherhood or norms, or how you start to understand for a family or a father in particular, kind of what his vision for himself is, how you work with him in a way that's responsive to his idea of what a father should be. And Calvin, I'm wondering if you want to start with that one.
Yeah, sure. You have to become a learner. When I became a CLC, it was immediately clear to me that my stance has to be a learner. I am in a space that's foreign to me, so I have to listen more, talk less, ask questions. Sometimes you can't deliver on the things that you say you can do to fathers. Things happen, but if you're in a maternal child health space, ask the father what works for them. Ask the family what's important to them in terms of values and things like that. And then follow their guide. Because even if you can't really do everything that's going to come out of that conversation, you set the standard that the father matters.
Thank you. Kevin or Darryl, would you like to add to that at all about how you get a sense of what a particular father and family is hoping for in terms of father's participation?
I do have something to add to that. And the very first thing that I have to say is, it is true that we're going to have to ask the fathers what they want. We're doing intake and we're also doing assessments. But sometimes it does help that we ask the mom what she expects out of the father. That's been helpful too. And part of that reason is because I think that once we get a feeling about if there's a certain attitude that the mom has about what the role of the dad is, then we might be able to avoid certain types of conflicts that, some certain types of conflicts are inevitable, but some don't need to happen, and they certainly don't need to be as intense. So that's one of my suggestions too.
Can I add to this too?
Yeah.
So we spend a lot of time focusing on home visitors' experiences of men and fathers in their lives, and to get underneath kind of what cultural understandings they have about fathers' roles in families, about fathers and mental health, and just how that might shape their, even just what it's like to enter a family and what expectations or assumptions they might have. And that's been helpful to keep that in mind as they're also kind of doing what Calvin and Darryl are talking about, checking in with mom about some of this. Calvin, as Calvin said about, being curious and open and not making assumptions, things like that. And I guess what people find is that this is pretty deeply rooted, their assumptions and biases, that we all have them. It just, our work is better when we are aware of what our biases are.
Thank you. So I think we have time probably for me to pull in one last question, and then we're getting close to the hour, at which point I'll turn it over to Dave. And there's a question about the role of fathers or involving fathers in the context of queer and or same-sex parents. So a question about involving fathers. Yeah, I'm repeating the question. I'll see if anyone would like to speak to that topic. Darryl.
So yes, I'd like to speak to it because that's been part of our assignment for many, many years now. And what we do recognize is that individual families have an individual identity or personality. And so we are trying to be as client-centered, as client-focused with our services as possible. So that's the reason why early on we are promoting the assessment. We have an assessment that we do by phone. We have an assessment that we do in person. And then we also have surveys that we're conducting if we have our group classes. And we don't have to do all of our classes in group also, because if we have a specific portion of the curricula that we want to introduce to the family, and the family says, well, we're not able to make it, or for whatever reason, they want to work with us in a smaller setting, we make ourselves available to doing that. Here's the bottom line, though. We want people to be satisfied with what we're providing. And so if it doesn't come out of our Milwaukee Fatherhood Initiative office, that's the reason why we have our partners and our other resource service providers available, just in case it's not fitting with what we're doing.
Thanks. Calvin, did you want to add to that?
Only to say again that the fatherhood field has a long way to go in this, right? It's not something that you see coming out of the fatherhood institutions and research organizations. So we do need some support and guidance for some practitioners. I love what you described, Darryl. But we do need support and guidance for fatherhood practitioners around serving gender fluid or other parents.
Thank you. And I'll just add one thing here, and then I'm going to turn to you, Dave. Some of the work that I've been doing, and I really want to shout out my partners at the African American Breastfeeding Network in Milwaukee and my colleague Alvin Thomas, since we've been doing this work together, is just really understanding for a family who's involved in engaging everyone, right? So if it's same-sex parents, then every parent who's involved should be there and be part of the support and the education and the resources. If there are grandparents who are playing a key role in helping to raise a grandbaby, they should be invited into those spaces. So, thinking that's something AABN I think has done so well from the beginning, is thinking about fathers and thinking about kind of every family member and every unique family constellation, understanding what the needs might be and recognizing the role of all caregivers in supporting a baby and a family. So with that, I'm going to turn to you, Dave. I think we're kind of out of time here.
We are, and Tova, I'm so grateful for your leadership throughout this webinar and bringing us all together here today. And Darryl, Kevin, and Calvin, thank you so much for taking the time to share your expertise and the experiences that you brought in here. Again, we are recording today's webinar, and so we'll send out that recording and some of the other resources that we've talked about today, and I'll have that out for all of you tomorrow. So again, thank you so much. And I just really want to thank our presenters again and everyone that joined us.
Thank you for inviting me. It's been great.
Thanks, everyone. And thank you. What a lively chat. So I really appreciate all of you who joined. Yeah.
Yeah, so great. So, okay. Well, thank you all. Bye now.